Hello there, this is John, and this is Chapter 24, Environmental Emergencies. So I first want to talk about hypothermia, and specifically generalized hypothermia, which means the entire body is being affected by the exposure to cold. So our body regulates its temperature in a number of different ways. We also are part of this process as well, consciously anyway. So, but physiologically, what happens is when our body recognizes that we're losing body heat to the environment, it does a few really important things. One, it vasoconstricts our blood vessels in our skin, and it pushes our blood from the skin to the core to keep it warm and away from the environment. And on top of that, it causes us to shiver. It makes our muscles quake and quiver and shiver, and that creates heat. Well, both of these mechanisms, whether it's vasoconstriction or shivering, it takes energy. And you can see if you are in a hypothermic state and you are shivering, if you're not gotten out of that situation fairly quickly, this mechanism that protects us diminishes and actually goes away because you lose the necessary energy to keep those things going. On the other side of this, we have the conscious side of it, which means if you're in a cold environment, if you're awake and alert and conscious and able to understand what's going on, well, of course, we're going to want to get out of that environment, put on some heavier clothes, get a hot toddy, whatever it might be. But let's say, for instance, you're unconscious, you're hurt to the point where you can't walk for some reason. Maybe you're a snowboarder, you hit a tree and you broke a leg. You're not going to be able to get out of that environment. You can kind of see now there's an issue with, even though you consciously would like to get out of that environment, you're unable to do so. On top of all this is if someone becomes more deeply hypothermic, our brainstem and brain start to get adversely affected by the condition. And it makes us almost become confused, disoriented, and sometimes can cause people do really weird things. For instance, there was a gentleman who was driving. He and his family were driving through the Sierra Nevadas, and they took a side road. It was in a snowstorm apparently, and they got stuck in the snow. Go figure. And they were there for a couple of days, waiting to get rescued. Nothing happened. So the gentleman decided to walk out to try to find help. So he left the family there, started walking across the fields in some direction. And then a few hours after he left, someone found the family in the car, and they were looking for the husband. Well, the husband was found 6-7 hours later, lying naked in the snow in the middle of this snowstorm. And so what happened to this gentleman is as he became more and more hypothermic, his brain and brainstem were malfunctioning. And even though he was bitter cold and the winds and the 20-degree temperatures and all that were freezing him, he felt like he was burning up because his body was telling him that he was on fire and he had a high fever. So he was ripping his clothes off. And eventually he died from his hypothermia. So you can say at some point, we no longer have that conscious ability to get ourselves out of that environment, even if we're not injured. So the various stages of hypothermia, for the record, basically anything below 95 degrees core temperature is considered hypothermia. Now, at this particular stage, they will have signs and symptoms. More than likely, they're going to be slightly disoriented. They might know their name. They might know where they are, but not too sure what's happening or why this all is, coming about and all that. There's still going to be shivering, and there's still going to be vasoconstriction to kind of help with the process. But now because their limbs are so cold, even though their core might be really warm still, their muscles, the actual skeletal muscles that they use, their fingers and their toes and things like that, the muscles are so cold that they've lost their dexterity. They wouldn't be able to tie their shoelaces or button a button, those types of things. And because we use skeletal muscles to speak, they also have problems speaking. So they can talk, but they sound really like muted or almost like they're having difficulty forming words. And this is because the muscles aren't working very well in their throat and in their jaw. So again, this person's 90 to 95 range. They're going to be symptomatic. You can see this process can continue if we don't get them out of the environment. So now if they drop below 90 degrees, now they're going to have some big problems, because this is where you're going to get that behavioral response, like the guy naked in the snow we just talked about. The shivering has already stopped, so that mechanism to protect the person is gone. So they're not shivering anymore, and they're now vasodilating because they don't have the energy left to vasoconstrict. So now you're seeing vital sign changes. The blood pressure's dropping, the heart rate's dropping, the breathing might become a little less effective than it should be, and they're sleepy, disoriented. Now they might know their name, but that's really about it. And again, they're getting into this more deep, severe form of hypothermia. You can see as this continues down, gets down below and into the severe range. Now we're talking someone who's unconscious or barely conscious. Their blood pressure is probably not obtainable. Their heart rate's really, really low, like 40 or less sometimes. Their breathing is either ineffective or absent at this point. And they're very, very close to dying if we don't quickly get them out of that environment at that point. Now, when it comes to body temperatures, the problem that we have with all this is that out in the EMS environment, we do have thermometers. We have a rectal thermometer and we have an oral thermometer, along with the tympanics and the other ones like that. But the rectal thermometers that we use on these patients, they go to 90 and they stop. So if this person is below 90 degrees core temperature, it's just going to say low, which really doesn't give us a number. But if you look at the fact that it is down below 90 and they're having signs and symptoms, it might give you an idea, based on their signs and symptoms, based on the degree of how bad off they are, how deeply they are into hypothermia. Either way, no matter where they are in this list, we're going to treat them exactly the same. So another form of hypothermia is from immersion in water. Now, I'm sure looking at that picture down below in the lower right side, pretty straightforward, slam dunk. Person falls into an icy stream. They can get cold shock. They can die within minutes of being in that environment. The water's 38 degrees. You can kind of get that idea. The heart can stop. All kinds of terrible things can happen. We don't see obviously too much of that here in the county of San Diego, but we do see a lot of people falling in the water or being in the water in the ocean or in the bays or in even the lakes around here sometimes. I've been on a number of calls in San Diego, the bay itself, Mission Bay itself. Think about it this way. So it's let's say it's August or September, July, whatever it might be. It's summertime. It's 90 degrees out. The water in the bay is 70. But remember, at 70 degrees, I mean, we're 98.6. It's still quite a bit below our body temperature normally. So we fall in a body of water like Mission Bay. You're in there long enough, you can become hypothermic even in that environment. So we always have to suspect hypothermia when someone winds up in a body of water for some reason or another that they can't get out of for one reason or another. Now, if you do encounter someone who has gone into cardiac arrest due to hypothermia for whatever reason, whether it's immersion or whether it's another reason, and they have no pulse, we're going to start CPR. We're going to start compressions and ventilations. We're going to start the rewarming process and get them to the hospital as quickly as possible. We're going to attach the AED, and if the monitor says shock advised, we'll give them one shock, and then any subsequent shocks are by base hospital direction. The reason why this is, if you think about it, this person's deeply in hypothermia, and their blood is very acidic, it's very acidotic, and they're very hypoxic. So their blood is thick, it's cold, it's really nasty. And we don't really want that blood to rush to this person's heart quickly, because it could cause the heart to malfunction even worse. On top of that, if we're trying to shock a heart that's severely hypoxic, it might not respond to the shock like a heart that is more better perfused. So the idea is, if it says shock advised, give one shock, give it a try, do your compressions and ventilations, get your rewarming going, give it 5 minutes or so, get on the radio, talk to the doctor about it on the radio, and get an order for a second shock. By this time, the heart probably is going to have more oxygen in it. It's going to be less acidic, and it might be more receptive to that shock, or that second shock, should I say. So this is another really common call for us, this urban hypothermia. Most common for me, working downtown in San Diego, is external hypothermia. This is seen a lot with the homeless populations, with people who they drink and they lie down on the corners after they're drinking. This gentleman down here on the lower left side, he's had a couple of 40 ounces. He's out cold. It might be 70 degrees out. It might be even sunny, but that concrete is 70 degrees or less even. So he's 98.6. So he's almost 30 degrees, hotter than that concrete. So he's unconscious or he's out cold. So he doesn't realize what's happening. So he can't get himself out of the environment. Also, as you probably already guessed, alcohol is a diuretic. It makes you pee. So he pees on himself. And then the urine is a great conductor. It's just water mostly, a great conductor of heat away from the body into the concrete. So he could easily become hypothermic on a sunny day at 70 degrees in downtown San Diego. Now, when it comes to elderly populations and people living in their apartments and their homes and all this, even in cars, sometimes I've seen this where you have someone entrapped for some reason. An older person who's fallen, they've broken their hip, and they can't get up, they can't get off the ground. They're inside their apartment, they're inside their house. The air conditioning's blasting out because it's 100 degrees outside in Santee, and all this cold air is blowing on them. And because they're elderly and because their body can't compensate quite as well for their body temperature, their hypothalamus isn't quite as, working, I guess, good working, what you want to call it. They can easily become hypothermic in their apartment under those conditions. Especially there's medications that can lead to hypothermia more readily, and they might be on that as well. The toe right there, the lovely toe right there, that used to be called frostbite, and now they call it a freezing cold injury. And literally that's what it is. It's that toe has become frozen because obviously the socks were wet, the shoes were wet, and of course it was really, really cold outside. Usually they have to be, close to 0 degrees temperature to start seeing things like this, or even sub-zero temperatures. But what happened is the water, the liquid, the blood, everything in that toe has frozen solid. And as you might know, when water freezes, not only does it expand in size, but it also turns into a crystal formation, which causes injury and damage. So this thing, basically, this toe has died, and they're going to have to cut this toe off. Now, to treat this, if you encounter someone who is hypothermic and also has this particular condition, you're going to treat both, obviously. Obviously, the hypothermia takes precedent, but once that's been done, you're going to obviously put this foot into warm water, usually about 104 degrees, as I remember. With this, it varies with different protocols, but 104 to 110 degrees is usually about the normal range with this. And we want to thaw this thing out as quickly as possible. The faster we can thaw it out, the greater chance it has of the toe surviving and not having to be amputated. So treatment for hypothermia is pretty straightforward. ABCs really doesn't change all that much. You're going to check airway, breathing, circulation, suction as necessary. Because in later stages of hypothermia, it might be really hard to feel their pulse because it's so weak and so slow. And their breathing might be so weak and so slow that you might be able to assess rise and fall of the chest very well. So at some point as you're going through this process, you might have to spend up to a full minute counting the pulse and counting the breathing to get an accurate reading on this person. I talked earlier about the rectal core temperatures. If you can get one, get one. That's great. If for some reason you don't have a thermometer or it's just not reading correctly, an easy way to do this is if you feel their limbs, if you put your hands on their arms and legs, they'll probably be really cold to the touch. And if you take your gloved hand and place it under their shirt and you place it on their abdomen, if their abdomen is still warm to the touch, but their limbs are cold, they're probably mild to moderate hypothermia. Remember, there's going to be signs and symptoms associated with this as well. If you put your hand on their abdomen and their skin is cold and their limbs are cold, they're more in the stage of being severe stages of hypothermia. And again, you're going to see the signs and symptoms that might correlate with this as well. So warming methods. Everyone who's suspected of being hypothermic gets a passive response. So we get them out of the environment, we take off their clothes, we dry them, we cover them, we warm them, turn the ambulance up to 85 degrees, and we try not to stimulate these people, we try not to agitate them, we would never want them to walk, we would never rub their limbs, anything like that, because I don't want that cold, acidic, hypoxic blood from their legs coming up to their heart quickly. It could cause their heart to stop. So very gently handle them, keep them warm, lay them down, transport rapidly to the closest emergency facility. If they're mild hypothermia, their temperature is like 92, 93 degrees or so, this might be all they need. They might recover. Those people they're pretty much with it, like I mentioned. They'll know most everything. They'll be talking to you. If they're not responding to your treatment or they're more severe, then you should go to the active phase, whereas now you're putting these warm packs to the groin, the armpits, and the neck. And then as the blood is circulated, it picks up the heat, takes it back to the core, and of course, it gradually warms this person up. We really want to warm these people up very slowly. It's about 1 degree per hour on average. That's what the hospitals do when we bring these people in. They wrap them up in these heat blankets, and they gradually warm them up over a period of time. So it gives their body time to acclimate and get rid of all that acid, and get the oxygen on board so that they won't go into cardiac arrest. So hyperthermia. Now I know you're thinking, what's a turkey got to do with this? Well, if anyone's ever cooked a turkey, and I'm not talking about the deep frying version, I'm talking about an oven turkey. If you put a turkey in an oven, you're cooking it for 4 or 5 hours, whatever it might be, depending on the size of the turkey. You want to pull that turkey out just before it's completely done, because we don't want it to get dried out. So you're going to take that turkey out maybe 15, 20 minutes early, and it's not quite as warm as it's supposed to be. We're going to put that on the counter and cover it. And what's going to happen while it's sitting there, it's going to keep cooking. Well, when you're someone who's hyperthermic, someone who has high body temperature because of a hot environment or exertion or exercise, you're basically a turkey. Because unless we stop the hyperthermic process by ice packs and things like that, you're going to just keep cooking. And I've seen people, I've worked a lot of the marathons, half marathons, triathlons. I've worked fire line with brush fire firefighters and all that. And I've seen as high as 105.7 core temperature on people because of just this. They became so hyperthermic, they just keep getting hotter and hotter and hotter. We need to stop that process. So our body also responds to gaining heat. So it recognizes we're in a hot environment and our body is gaining more heat than we can lose. And so we can do our body does a number of things. Now, obviously, consciously, we could get into a room that's air conditioned, drink some fluids, get out of the environment. But let's say you can't because something happened, you're lost in the middle of the desert, you broke your leg, you crashed your car, you're basically kind of stuck. What the body can do for you is it obviously sweats. It shunts blood out to the skin, so it causes vasodilation. It brings blood out to the skin. As the blood's out there, the warm blood's out there, and as that sweat evaporates, you lose body heat. With that, You breathe faster, so now you're breathing in cooler air and breathing out hotter air. There's all different ways your body can help you get rid of this excess heat. But again, you have this mechanism where eventually it doesn't work anymore and your body becomes overwhelmed by this excessive heat. The three types of heat-related emergencies: heat cramps, heat exhaustion, and heat stroke. So heat cramps are the most common, and there really is no progression to this. People can go right into heat stroke, but heat cramps are the most common that we see out there, and this is a problem with lack of electrolytes. Someone's been running a half marathon, a 10K, working in the yard, whatever it might be, in a hot environment. They haven't really been drinking enough, like some kind of Gatorade or Pedialyte, something that's electrolyte based, and they lose a lot of electrolytes, and their legs cramp up and their abdomen cramps up, and they pretty much can't continue. They sit down. That's how you're going to find them. They're going to be oriented. Their vital signs are going to be pretty stable, but they're pretty much done for the day. They need some type of, again, some kind of Pedialyte, some kind of electrolyte replacement fluids. They need to get out of the environment, into a cool environment, obviously, and they should not continue what they were doing because they can then progress possibly. Heat exhaustion, I see this quite a bit on marathons, half marathons, those long triathlons and things like that. I've seen it on the fire line as well when the firefighters are fighting brush fires and house fires as well. And so this is a case of this person, they may or may not have cramps with this, but primarily they just feel really weak. And they're so weak, they got to sit down and they just can't get up. They're usually oriented, they're talking to you, they're dripping with sweat. And if you were to touch their skin, it's ice cold. Their heart rate's really fast. Their breathing's probably really fast as well. Again, this person's done for the day. They need fluids. And this is the person who would really benefit from going to a hospital and getting some type of fluids intravenously. Now, you might be at a triathlon and the medics might be there. The medics can do this for this patient. But if you lost that much fluids and all those electrolytes, to try to regain all the fluid and electrolytes by just drinking things, it'll take you days to recover. Whereas if a couple liters of fluid intravenously, they feel pretty good by the next day. But they're done for the day. They should not continue on. You cool them down, get them out of the environment. In both the cases of heat cramps and heat exhaustion, if this person's awake and alert and not nauseated, and they can do so, we can provide them with little sips of some type of room temperature solution like Pedialyte, like Gatorade type product. We don't want to give them just plain water because that's actually can cause more problems. The one we really want to look out for, because it's the real killer here, is the heat stroke. That's the turkey. That's the person who just keeps getting hotter and hotter and hotter and hotter until we intervene with cold packs and obviously getting them out of the environment. Now, what's come to light in the last 10 years or so is hyponatremia. And basically what that is low levels of sodium in your body. So you've been running a marathon, you've been drinking tons, you were told by somebody, drink tons and tons of water, tons and tons of water. So between you sweating it out and peeing it out, you're basically peeing out all your sodium. And what this leads to is it leads to swelling of tissues. It can lead to your brain to swell, and you can literally die from this. You can have seizures. A lot of terrible things can happen with hyponatremia. So again, we don't want this person to drink just plain water. We want them, if they're going to drink something like, again, what we talked about, some kind of Pedialyte product. This can also happen at parties where there's drugs involved, especially some type of amphetamine product, and there's dancing and lots of exertional stuff going on. They can maybe go through the same process and they can go into heat stroke, and they can also have hyponatremia as well. Now, reasons why you have heat-related emergencies kind of make sense. The climate. So it's really, really, humid that day. It's hot and humid. You're doing something strenuous. You may or may not be prepared for it. I've talked to a lot of my patients, especially on like marathons and half marathons. I'd have someone who goes into like heat exhaustion, and after I get them stabilized and we're talking, I ask them, so what did you prepare? How did you prepare yourself for this race? Oh, my coworkers at my business where I work, they said if I could run 5 miles, I could run 13 miles. So they get into the situation where it's hot and they're not prepared, they're not acclimated to the process, and they're pretty much doomed to fail, unfortunately, because of that. Older you are, obviously, you can't, elderly people can't compensate quite as well for these types of things because the way their bodies function, the hypothalamus and the compensatory mechanisms that they use to maintain body heat just doesn't work as well as a young person. They might have various drugs and medications that can cause this to happen as well. I know there's one medication, a psychiatric medication, and there's a hypertension medication that if you take them, you're more prone to going into heat exhaustion and those types of things. You guys get the idea. Uh, so I'm sure you'll read your textbook, but this chapter anyway. And their assessment basically is pretty much the same. It's, hi, hello, hello, wake up, sir, sir, sir. ABCs, oxygen as necessary. In most cases, they really don't need oxygen. They need to be cooled down, pretty much. You will get some type of temperature on them, get a history, see what's going on, vital signs and all that. What we're really looking for is someone who is in heat stroke, because that's what's going to kill this person. And so consequently, your books talks about hot, dry skins. And skins kind of fool us sometimes because people can be in heat stroke and they can have sweaty skins. So you see someone with really sweaty skins and you think, oh, he's just in a heat exhaustion, he'll be okay. He's actually in heat stroke. So what I look for, what we learned to look for over the last few years anyway, is we look for alterations in their mental status. So if someone's overheated and they're confused, they're disoriented, if they can't walk, if they keep falling down, that's heat stroke. No matter what their skins are like, this guy is so hot that his brain is malfunctioning, his brain stem's malfunctioning, he can't talk to you, he's stumbling around like some crazy person. That person's in heat stroke no matter what their skins look like. So just keep that in mind. Might just save someone's life at some point. Heat-related emergencies, your treatment for this. So it's obvious, get them out of the environment, get them into a cool environment, take off their clothes as necessary, start the cooling measures. If you're talking about working like special events like marathons, especially marathons and half marathons, if you go into the first 8/10 of these larger events, there's usually a first aid tent every few miles. They're staffed with a nurse or a physician. And what you'll see in there is you'll see a portable bathtub. It's a plastic portable bathtub. And they have bags and bags of ice. And if I brought somebody in who was severely hyperthermic and they were in heat stroke, they would put the person in the tub and pour ice on them. We want to rapidly cool this person. This is the turkey. We want to stop the burning process or stop the heating up process anyway. If it's a mild presentation, like I said, it's heat cramps or maybe a mild case of heat exhaustion, and they're awake and alert and they're not nauseous and they can swallow and all that. Liquids are fine. But if this person's in heat stroke, so what if they have an altered mental status? They're in heat stroke. You start the ice packs on them. You want to cool them down as quickly as possible to get that body temperature down to where the brain doesn't get damaged. Because 104, 105, 106, 107 degrees, we're talking brain damage at this point if it goes on long enough. So moving on to other types of environmental, in this case, maybe envenomations. So you know what that is right there. I've been on quite a few rattlesnake envenomations in my career. And it's usually not the rattlesnake's fault. It's usually the person's fault. Go figure. So the only snake here in the county of San Diego that can envenomate you is a pit viper or rattlesnake. They have two large fangs. They have a venom sac, obviously. And if you think about what that venom is for, it's so they can eat. I mean, they paralyze the bunny rabbit. They kill the squirrel, whatever it might be, and that's their lunch or dinner or whatever it might be. They really aren't out to get us, in truth. We step on them inadvertently. We play with them, go figure, which is really stupid. and we do get envenomated. There's three basic types of toxins that they can administer to you or inject you with. The first one is a hemotoxin. Hemotoxins affect your blood, and they basically cause you to bleed internally. So imagine if you're the bunny rabbit, you get envenomated by a rattlesnake, you bleed out internally, and then you get eaten. The other one is a neurotoxin, and it causes you to get paralyzed. So the little bunny rabbit gets envenomated, it can't move a muscle, and it pretty much gets eaten for lunch. Because of the hundreds and hundreds of years of adaptation, there are some snakes that have both. They have hemo and neurotoxins as well. It doesn't really matter to us in the field. The doctors can recognize this. It's the same antivenom that they all get the same antivenom, but the effects can be different. So if you look down the bottom right, so that person got envenomated by a hemotoxin. So it literally caused his tissues to basically sort of fall apart, melt, break down over time. Those kind of pinkish, reddish looking pieces of thread holding his hand together, that's exactly what it is. It's holding his hand together because he's lost all that tissue from this envenomation. Now, consequently, one thing is for certain is we do not want to see the snake at the hospital. If the snake was killed by someone, don't bring the head with you. Don't bring the snake with you. They don't want to see it. And even though the head's been separated from the body, the head is still venomous. And if you somehow were to get bitten by the fang, you could get envenomated even after the poor thing has died. If there's a constricting band, if someone prior to arrival put a tourniquet around this person's arm or leg, take it off. We do not want any kind of constricting bands. We want to promote the actual perfusion to that limb. It reduces the chance of any permanent damage like you see in that picture down there at the bottom. You're going to take a black marker and you're going to mark the site of the end of where the swelling stops and where their pain stops. And you're going to put the time. You can see in the picture on the upper right side. And as you're going through the call, you're driving to the hospital, you can mark the arm up a little further. You're just seeing how quickly this is progressing. To give you a point of reference, one lady, she was a ranger at Lake Hodges Dam, and she got envenomated by a juvenile rattlesnake. And it took me about 10 minutes to get there. And by the time I got there, her entire right hand up to about her watch was about double in size. By the time I got her to Palomar Hospital, her whole arm was doubled in size up to her shoulder. So in about 20 minutes, she progressed that much, even with treatment. No ice packs because we want to promote perfusion. We don't want to slow down the process of perfusion because, again, it can cause more damage with this. And you're going to get them to a hospital that has the antivenom. I would call ahead to a base hospital and say, hey, we have a rattlesnake envenomation. You guys have the person weighs, 200 pounds, 90 kilos, whatever it might be. And you guys have enough antivenom to treat this person. If not, go someplace else. It's really, really important. Keep the limb below the level of the heart. You can put it in a sling if you want, or whether it's a leg, whatever it might be. Take off, rings, watches, those types of things, because it is going to swell up quite a bit with this. You don't have to have two sites of envenomation. You only need one of the fangs to get you. So if you just have one hole in their hand or one hole in their foot, that's enough to envenomate them. Other types of envenomation. So I worked in San Diego a long time. I used to go to the shores all the time for stingray envenomations. Every summer, it was like pretty average call we used to go on. And usually, I'm sure there's probably some lifeguards out there, but usually when somebody gets envenomated by a stingray and it's a normal envenomation, in about 45 minutes with treatment, the pain gets alleviated. I would usually get called in because the pain didn't get any better. Usually, if the pain doesn't get better with like warm water, usually it's like 110 degree water, kind of heat packs, water packs, things like that. It means something more than it should be. So either the stinger is somehow embedded in the person still, it broke off during the envenomation, or there's some kind of bone involvement with this. So this person needs to go to the hospital to get checked, to get an X-ray to make sure there's nothing in there that's going to cause any problems. But primarily warm water. I believe it's 100. The county says 110 degrees is the optimal temperature for this. You dip their foot, their hand, whatever it might be, into the water. We do have jellyfish here in the county. One thing I've noticed, I've gone on a couple of calls where because the jellyfish break up in the surf and they wind up on the beach and they look like little like clear jello, little chunks of clear jello on the beach. And I've had a couple of people step on these, even though this animal's dead, it's been dead for a long time, it can still envenomate. And even though you're not out in the water, you can still step on them. And very painful. And the county says salt water. So if you have a jellyfish envenomation, you would provide them with salt water. I wouldn't put them back in the ocean, obviously, a bucket of salt water. Warm water works well for this too. National Registry says to use vinegar to neutralize the poisons. You can scrape off the little stingers as well with this. Other types of envenomations from insects. So we have bees, wasps, we have spiders and scorpions here. Bee envenomations, unless they have some kind of allergic reaction, we don't get called out for this. Same with wasps. Now with wasps, obviously, wasps can sting over and over and over again, where bees can only sting once with this. But again, in the case of both the wasp and the bee envenomations, if you do get called out, you could apply a cold pack to this to help reduce the pain and obviously reduce the swelling and all that. We're not concerned about perfusion to these types of envenomations. Now, the only two spiders that, well, primarily the one spider, I guess, is the black widow. We have a brown widow now as well, which has the same profile, the same hourglass configuration on its belly, but it's a light brown color versus the black color that we're more used to. They're both venomous. They can both envenomate. If you're a really, really tiny person, like a little baby or something, they can be lethal. If you're really, really old and you have lots of like bad medical conditions, it might be bad for you. The average person, though, who's healthy, it's uncomfortable. It can give you abdominal cramping and discomfort and nausea, and the site does hurt. The envenomation site does hurt and all that. Again, we can put a cold pack on the area. They should go to the hospital and see a doctor about antibiotics and all that as well. So not so much here in the county of San Diego, but you go to the southeast and the southwest, we do get brown recluse. Now, brown recluse is a little different. Its bite is painless. You don't feel the envenomation initially. And the toxin that they inject in you is necrotic, meaning it literally melts tissue. And people can die from this if it's not treated correctly. We do have what's called a desert recluse here in, I think it's out in Borrego Springs area. Apparently it's not quite as lethal, but and they're a lot more rare. But the true brown recluse you see like in Texas and Louisiana and places like that are probably a lot more dangerous than what we have here. We have scorpions down by the border. I think they're called bark scorpions. I've been told the envenomation feels like a wasp sting. It's pretty painful, but not lethal unless you have a reaction to it. But in this case, if you have a bee sting, you can take off the stinger, take it out with like a credit card or something. Definitely an ice pack, and just watch and make sure they don't go into anaphylaxis or something like that. Lightning strikes. We do get lightning here, especially up in the Cuyamacas and the Lagunas in particular. Lightning strikes are life-threatening a lot of times. The problem with this is that when you get struck by lightning, you can stop breathing. It can stun your central nervous system. It can stop your heart, and then you're basically in cardiac arrest. What happens is if no one's around, sometimes the heart can restart itself, but the breathing will still be stunned. So your heart restarts, but then a few minutes later, because you're not breathing, it stops again. So a lot of this has to do with, maybe for us, it might be just like airway control and ventilations and all that to keep them alive. they're going to have wounds. Usually wounds. If wherever they were standing or sitting, it's going to go through their body and exit somehow. They're going to have broken bones, shattered, broken bones, burns, bleeding. You're going to treat that stuff, of course, symptomatically. So just realize that they might have a pulse, but not breathing when you get there. So lastly on this is, and this is something, I don't know if you've ever been up to like the top of San Jacinto or Mount Whitney, which I believe is about 14,000 feet or so. So when you get up into those high altitudes, the atmospheric pressure is lower, and it can cause various things, like it can cause the movement of fluids in and out of our cells, and can cause edema to our brain, causing brain swelling and seizure-like activities and stroke-like activities. And you can even die from this at really high altitudes. HAPE is kind of the same idea. You have because the pressure is much lower there, fluid leaks through into your lungs, fills your lungs with fluid or water, plasma, if you want to call it that, leading to pulmonary edema, so you can't breathe, you become hypoxic. And really, the only cure for both of these is rapid descent. So get them down off the mountain to like a normal lower altitude. Takes care of most of the conditions. Of course, you give them high flow too, and but you get them out of there as quickly as possible. I think we're done.